We have a question coming in from Linda, which I think you've kind of answered indirectly here. She said she was diagnosed last March. She's on a good diet. She walks 2 miles a day. She doesn't smoke. She does take Plavix. It's in her right leg. She cannot walk further now without pain. And she even is starting to have some rest pain. And when she goes to the grocery store, it's like it's limiting. She wants to know if everyone pretty much with those symptoms end up with a stent. She's 78 years old and she's hoping not.
No, so everyone doesn't need a stent. Everyone doesn't need a bypass. Some people can get away with the balloon, and some people get away without any procedure at all. So it really depends on how bad is it. What are your arteries looking like when you do either a CT scan to see the arteries or an angiogram? Our goal typically for most of us who do this at kind of a high level is try to avoid a stent unless you have an area that is going to come back down right away. What you have to remember is anytime you have a narrowing or a blockage, we're going in with wires and balloons. And what we're doing is we're cracking open that vessel. But just think about that pipes in the house I told you about. You can have a 100-year-old house. You clear out some pipes with a roto-rooter, you call your plumber. I can guarantee you at some point the pipe's going to clog up again. Same thing here. We go in there, we crack a balloon. We're not replacing your artery. We're trying to recreate a channel. But now we irritated your vessel. It causes inflammation. That narrowing is going to try to come back. Sometimes we use drug-coated balloons to try to prevent that narrowing from coming back so fast. But if we can get away with it, several of us will try to use a drug-coated balloon and try to see how much time do we get. If on the table we can't get a good expansion, that's when we put a stent typically. Or if you have a complete blockage, and a lot of times when you have a complete blockage, when you try to go through that concrete, you're not always in the middle of the vessel because there's no middle of the vessel to find. We'll be going through the side of it. And in those scenarios, a lot of times a stent will give you a better chance of staying open. So you may need a stent, but it's hard to know just based off one blockage or a description of a blockage, do you need one? Sometimes stent gives you the longest patency. The best long-term patency you can get is if you're healthy enough to get a native vein bypass for a long occlusion. You have to have a normal vein, superficial vein. You have to have a good surgeon. You have to be healthy enough for surgery. You have to recover from the surgery. And those are all possibilities. And, age is not always a limiting factor. It could be many other scenarios.